Súbele.
tanto así.
¿Qué?
Grábalo de lado. Hold on, I'm gonna raise the volume. I can't hear you.
Okay.
It's on the bottom. Okay.
Can you hear me okay?
Yeah, now we can.
Okay, perfect. Okay, so how are you doing?
I'm hanging in there. I think I got big again.
Okay.
So, cause like it's all hard again, and then it's like it's hard to breathe when I lay down again.
Gotcha.
Yeah.
Did you feel better after they removed the fluid?
I did, yeah. I've also started to get like sharp pains down by like my ovaries.
I see.
Yeah.
Okay. And the breathing wise, I know they took some fluid also from your lung.
Yeah.
Or around the lung. Is the breathing better?
It was afterwards, but now like when I lay down, I can hear like a raspiness almost, or like a
Gotcha.
yeah.
Okay.
Or I have to cough.
Gotcha.
That kind of thing.
Are you having any fever, chills, night sweats?
Night sweats, yes, but not fevers or chills.
Okay. And night sweats are like blocked.
Yeah.
But you've also been hot. Like, you're hot all
I
the
mean,
time.
yeah, I'm hot all the time, but like the sweats usually happen like if I'm sleeping. So anytime like I take a nap or something, then I end up like just sweating like everywhere.
Okay. Like, is it like getting your clothes wet or the sheets?
Yeah.
Okay. And how is the energy? If you're getting weaker, stronger, the same?
It's pretty low. I do try to still stay active. So I do at least once a day walk around the block, and try to do something. But yeah, like it's not how it was before.
Gotcha. And any swelling in your legs?
No, no swelling.
Okay. And I'll just go, I guess, along the list to make sure that there's nothing new going on. Lumps or bumps anywhere that you felt?
No.
Okay. Any bleeding or discharge from down below?
No, no bleeding, but I mean I do have discharge.
Like no blood coming out?
No.
Okay. Any difficulty urinating?
No.
Any swelling in your legs? Nausea, vomiting?
Nausea, yes. No vomiting.
Diarrhea, constipation?
No diarrhea. Constipation a little bit, but because you told me to take something because of the oxy, I was taking some like stool softeners, so that helped.
Okay. Okay, and this is the pathologist replying to me because I asked him about your sample earlier. Okay, and weakness in arms or legs, one different than the other, tingling, numbness in hands or feet?
No.
None of that. And no bleeding from nose, gums, and urine or stool or big bruises?
No.
Okay. Okay, so we got that PET scan. I don't know if you read the result.
Yeah, but I didn't understand it at all.
No worries, no worries. We'll go over it. So basically, they did see that in the abdomen thing is actually pretty active.
Okay.
Right? It's high activity, meaning, well, that can mean anything. I mean, yes, cancer cells are usually active. They light up, like we saw before in the stomach. Inflammation, infection, anything can light up really, really intense. But of course, we have that concern. Now, they did not see anything in the chest per se. And well, let's go over the lymph node. I think they were actually okay.
Meaning that it's not lymphoma.
Well, I don't know that, right? There are some entity called sometimes ovarian lymphoma. But I can say that the LDH came high, which can be high in lymphoma, but can be high in other conditions. The CA-125, which is a marker usually used for ovarian type, is high, very high as well.
Okay.
So, but it can be high also in ovarian lymphoma. did reach out. I think they reached out to you as well as scheduled an appointment with the GYN doctor.
Yeah, today at 4.
Correct. I spoke to her, and after she looked at the scan, she would recommend the PET scan. She does think that we should do a biopsy to figure out what that is. That was before we got the marker. I sent her a note about the marker, the CA125. But my suspicion that's what she would still recommend.
Okay.
So she will be recommending doing a biopsy, possibly to figure out exactly what that is.
Okay.
And I just followed up with the doctor, the pathologist, about your fluid results.
Yeah.
And those are not back yet, but they sent it to someone who specializes in that in, I think, San Francisco, I believe, South San Francisco, or hematopathologist. So I'm going to reach out to her
Okay.
and see if she has update for me.
Okay.
The flow cytometry, the initial one, did not show lymphoma cells. But large cell lymphoma, as I may have mentioned before, sometimes those cells kind of dissolve and they don't show there. But the initial read there did not show B cells, which is what the large B cell lymphoma you had.
Yeah.
So I'm going to reach to the doctor there over and ask her to see if she got any update about the cytology, which is when they get that fluid, they spin it and they look under a microscope to see what those cells are, if they see cells.
Okay.
So I think our next step will be really based on recommendation from the GYN doctor that you will see today, or you'll talk to her today. Probably proceeding with a biopsy, establish what the diagnosis is, and then treat accordingly.
So
In terms of, go ahead.
did the PET scan and all the other tests, did it like help narrow down anything?
It did. The other tests, I mean, the cytology will help some, but even if it's negative, will not rule it out completely because sometimes they don't see it. The PET scan helped to see, it didn't show like it was previously in the stomach. It didn't show previous locations. And they did say lymph nodes did not show there. So that, yeah. Anyway, we will need that, what we call for staging. Whatever this is,
Mm-hmm.
we will need to know if it's only there or in other places. There are some in the belly, multiple places in the belly.
Can I see a picture of the PET scan?
Sure. Show you that, open that and share my screen with you.
Okay.
Let me see how I share my screen here.
Oh, I said something. Send us? I didn't see that.
Are the images something you can send us also, or?
I do not have a way of that other than
Oh.
doing like a screenshot.
Okay. Yeah. I'll take a picture of them.
I mean, you can take a screenshot if you want.
Yeah. Yeah.
Okay, let me know if you're able to see it.
Yes.
Okay. So this is the latest one. Did you want to see the one before or do you want to see this one?
This one, right?
This one.
Okay,
Take a picture of the last one.
we'll go with this here. You're able to see the big picture?
No.
Oh, you're not seeing anything now?
We're still seeing the
Kind of.
slides of the individual pictures.
Oh, not the big one? Okay, let me try again. Share my desktop again. Okay,
There we go.
you're able to see it now?
Yeah.
This aside. Okay, so again, what lights up is what's active. So active cells light up. This is in the brain here, it's dormant because it usually will always will be using sugar, so that's active.
Yeah.
So this is we're going down. We're starting to see some activity here in the belly, in the pelvis area. Right.
Oh man.
So this is what's here. There are some spots here as well.
Does this still indicate that it's limited to the 2 ovaries?
No, actually they did see some outside, like these are in the peritoneum.
So this huge bulge here in the middle, is that like one or?
That is one.
And
This
that's,
one is one from the ovary.
is that the one from the right ovary? That's the bigger one?
Correct.
Okay.
So this is your stomach here. It's pretty clean.
Which looks great now.
Yeah, the stomach looks fine. I mean, even that small residual disease in the past is not there anymore.
Yeah.
What's that?
But those are kind of new things there.
So is it still both ovaries?
It is on the both ovaries. Let me put it this way. Okay, let me go back to there.
Is it possible that because we're not familiar with this, those last images seemed like a lot more than it actually is, with some of the highlighted locations?
I'm sorry, come again?
Because we're not familiar with these images, is it possible that that last set that you showed us, it looks like more than it is with the highlighted areas?
I
That's
mean,
about right.
it is focused there, right?
Okay.
It is. So what lights up is actually the mass there.
Okay.
So this is the bladder, that's okay, that's normal. Here is the thing, so if you look, it's all big one thing, and there's small knot here. I think that's, I believe, the other ovary here.
Okay.
So this one is a big thing, but there are spots in other places, so it's also outside the ovary.
Does that make it stage 4 then?
Well, I don't know what that is yet. I need to know what that is. If it's lymphoma, then no, because it's one side of the diaphragm. It's all below. They didn't comment on anything above, although this is here, but there might be some fluid around. Okay. So this is the stomach here again.
Yeah.
The stomach here looks fine, no issues with it.
Yeah.
But these are, so I don't know if that's lymphoma. This is around this here. So this is the chest here. This is the fluid in your lungs. This side, which is on the right more than the left.
Yeah.
And up here, there's nothing. This is the brain, that's normal.
Yeah.
So, yeah, I think we really need to know what that is.
Okay. So when they biopsy, how does that work?
You mean how they biopsy?
Yeah.
They go through the skin here. Usually, they do an ultrasound, go with a needle here, get a biopsy, and come out.
Oh, okay, just with a needle.
Right.
Oh, okay.
And sometimes when we see it's from the ovary, we don't want to touch it before we consult with the GYN doctor.
Yeah.
Sometimes they don't like to biopsy it if they think it is cancer. Not to have it. There's some risk, although probably low, of it spilling outside in the ovarian. But in your case, I mean, we already see some spots outside.
Yeah.
So I don't think that's what the PET scan here, because on the CT scan they didn't really see them outside.
Yeah.
There are some spots here outside, so I think definitely reasonable to get.
And that's most likely the same cancer though, right? Like it wouldn't be different.
You mean lymphoma?
No, she
Or
means consistent with the
All
ovaries and
together?
the locations outside.
yeah.
Yes, that's actually the same.
Okay.
But that will be also unusual. By itself, it is unusual, right? To have, if it is lymphoma, that's really unusual because 3 months ago, all of this was not there.
Yeah.
Yeah.
And where it was initially actually didn't come back, and the lymph nodes here did not look to be involved. So that's unusual.
Yeah.
If it's a different type of cancer, that's also really unusual because what's the chances that you will get another one like right after the first one?
Yeah.
So that either way, it's really unusual. So we need to figure out what that is.
Okay.
We need to figure out what that is.
Do you
So,
think
doctor, go ahead.
Sorry, do you think this is something that like because it seems so fast growing? I remember last time you said that the type of cancers that are very fast growing are usually the ones that respond best to treatment.
In general, in lymphoma, that's correct. They respond quick. Lymphoma in general responds quick. Now, depending on the type, we'll have to figure out, and on the biopsy, on how they look.
Okay.
On how they look. Yeah. Yeah. Now, I don't know in this case if this is, it will depend on the type to see how that will respond or not, and then the biopsy and testing on it.
Does it look like it would be ovarian cancer? Like, does that look common to like what ovarian cancer looks like?
Would that be consistent with what we're seeing?
Well, I don't know. That's still quick, even for that. So I don't exactly know. I think the doctor from the GYN doctor, Dr. Mori, I think Mori, might feel that it's more of lymphoma. Which there's a chance that it could be. There is an entity called ovarian lymphoma.
Mm-hmm.
I would say it's unusual.
Yeah.
Because you responded pretty well. The scan in between was great, and the other places where you had the bulk of disease didn't recur or didn't show activity.
Yeah.
So really, the biopsy will be important to know what we're dealing with.
So the biopsy should tell us exactly what it is now.
They should. In general, they should. When they do the biopsy, they should be able to differentiate what is going on. Sometimes they do a biopsy and they get tissue that is like dead tissue, what they call necrotic tissue, and they cannot tell much from that tissue. If it's like dead tissue, they cannot tell how the cells look. They all like dying cells. But I think they should be able, and that biopsy should be relatively easy to get.
Yeah.
It's close to the abdominal wall,
Yeah.
so they can go kind of an ultrasound and straight in there and get their biopsies and come out.
Okay.
I don't know if you know for the next steps, she'll meet with the OBGYN today. Do you know how quickly typically a biopsy can get done and results can get back after that?
So biopsy can be done in a few days sometimes. Sometimes they'll get you in, like they got you in for the paracentesis.
Yeah.
Like for they got you in like in about 2 days or so, I think. Okay. So the biopsy may be, I would say a few days, maybe a little longer. Okay. And they can do paracentesis if you want at the same time to help with that.
Yeah, that was another question I had. Like, is there anything I can take to help with the liquid, or is it just the paracentesis that's like available?
Sometimes we are able to use some what we call diuretics, like water pill to make you urinate a lot. That might get you a little dry though. We use it more actually in liver disease when they are building up, or heart disease when they are building up fluid. That's possibly can be used. The best way is really to know what that is and treat to make it stop getting the fluid. But technically, can we try those fluid pills? If that is coming back so quick, one option is actually they can, when they do the paracentesis, they put a catheter there, and you can keep it there. And at home, you can just open it, hook it to a bottle, and it drains. dosed again.
You know?
And, well, I don't know if we need that this time. I think we can do maybe
Yeah.
another paracentesis and see how it goes.
Okay.
And we can do paracentesis like every, I don't know, week or two if needed to help
Okay.
with that.
We wanted to
Okay.
ask, because it seems like this fluid has come back so quickly, could we actually do a paracentesis before the biopsy? Because she's already kind of,
Uncomfortable.
yeah.
Let's see, they may be able to get it and do it at the same time, both of them really quick in the next, I don't know, couple of days hopefully, like
Okay.
this week. So they
Okay.
may just do it at the same time, get that paracentesis and just go ahead and biopsy.
Just in case the biopsy couldn't be scheduled until next week, could she still do the paracentesis before that?
Sure, yeah, we can. We'll just, if we can bundle them together, it might be just more convenient for her. If
Absolutely.
she has to come and go there.
Yeah.
But no, yeah, we can. They are not necessarily related to each other.
Okay.
We can do it. But my estimation, if they can get her in for the paracentesis, they may add some time, a little more, and just do the biopsy at the same time.
Okay.
Because it's a quick biopsy, they kind of stick the needles. It's not, it shouldn't be like technically that
Yeah.
difficult.
And it's the
So
same
the-
department?
Yeah,
Oh,
the same doctor
okay.
actually.
Oh, okay.
Yeah, so the same doctor will be doing the procedure, which they use ultrasound to put the paracentesis. So he might just switch the other one and do the biopsy at the same time.
Got it.
Which
Okay.
I think
Okay.
he will be able to do both probably.
Yeah, makes sense. Okay.
Oxy?
Yeah, my other question was, is because I've been taking the oxy to help with pain. You told
Okay.
me it was okay to go up to 2. So I've been doing 2 in the morning, like around 6 in the morning. And then in the afternoonish, like around 4, I may take 1 or not, depending on how my pain is.
Okay.
And then I take another 2, like around 10, to help me go to sleep.
Okay.
But I was wondering if that's okay, or if there's, because really it's only like at night
Okay.
that my pain is worse.
Is it making you too sleepy?
The oxy?
Yeah.
Yes and no.
You know, what we worry about the oxy on all these narcotics, when they are in too high dose, patients may get sleepy. And sometimes when they're too sleepy, even it also slows the breathing. So we don't want the breathing to go, because they can go really loose on breathing and have issue with that. So if it's not making it, you can use it 2 pills 3 times a day. That's fine if you need. Or 2, 1, 2. That's fine. I'm
Okay.
okay with it. So that's
The
okay.
the
It can
only
make you constipated though, so make sure you use laxatives.
yeah, I started using some like veggie stool softener stuff.
Right.
But my only other issue is that the prescription that I have is not
I'll put a
enough.
new one for you.
Okay. And
I can
that's
put a new one for you.
and that's a good amount to take. Like if I feel like it's not working or it's not giving me enough, like I'm still in pain. Could I get
After taking 2,
yeah.
well, let me know. If the pain is all the time, I can put you on a longer acting one.
Okay.
So you take twice a day, and then you have those ones to what we call breakthrough. In case you get more pain, you can take 1 or 2 in between.
Okay.
But if it's as needed, that's fine. You can take 2. I mean, yes, I use higher sometimes in some patients if the pain is too much. But if 2 is doing it, we use the lowest effective dose.
Yeah.
Right? Trying to minimize the side effects of it, but also want you to be comfortable. We don't want you to have too much pain, and we don't want that as well. So we'll just balance it. And I trust that you can do that. I mean, if you tell me that 2 is not enough, it's not working,
Yeah.
I need to take 3, we can.
Because
We can if we have to.
again, it's only at night. Because during the day, like I'm fine most of the time. It's only nighttime that like I just don't sleep, and I feel like the medicine only works for like 3 hours, and then I'm up
I see.
again. Because it just like I'm just in pain.
Okay. Do you want me to get you on the longer acting one?
Maybe the longer acting one.
Okay. Okay. Yeah, in general, when we're using things, should use that. So I put the longer-acting one. I
Okay.
put a 10 milligram of that.
Okay.
It's every 12 hours.
Oh, we lost you.
Do you have? Oh, sorry, can you hear me?
You lagged out for the last 5 seconds or so.
Yeah, I know. It's kind of the connection here seems to be a little bit laggy. Okay. Do you still have any of that 5 milligrams oxycodone?
Yeah.
Do you have like a couple, or you have quite a few?
No, I have a couple. That's my oxy.
Just wondering if I need to send you a prescription for that as well, or you're okay. You got 23 days ago.
I have 4 left.
Okay.
So that's pretty just good
So
for
let's
today.
do that.
Yeah.
So yeah, that's not enough. So I'm going to put the longer acting one.
Okay.
So at least you can get some relief at night. You can use it if you want twice a day, or if you want just to take it at night. I'm okay with that.
Okay.
You can take it at night so it lasts longer and you can sleep through the night.
Yeah.
I'll go with only 10 milligrams for now. Like what are you doing? It sounds like it is working in reducing the pain. It's just wearing off quick.
Yeah. Yeah. That's what it is.
So let's do that. Let's do the 10. It works for the pain, stays longer.
Okay.
You can take it twice a day if you want. You can take it one at night if you want. That's fine. I'll send you probably another, I don't know, like 20 of those. Well, yeah, I guess send you around another